Hello everybody. Every now and then you will find somebody giving magical solution for diabetes, a single pill cure, maybe a contact program and it's all over. Is it really like that? Let us look at the science and the basic of diabetes and then you make your own decisions. It is defined as a fasting blood sugar of more than 125 and a postprandial, which is 2-hour post-meal sugar of 200 or more on multiple occasions. You just need the blood sugar levels to diagnose diabetes. And if you have sugars between 100 to 125 fasting and postprandial between 120 to less than 200, you are said to be pre-diabetic, which means you have a greater predisposition to develop diabetes and associated problems. So you should be on greater surveillance and lifestyle modification. The sugars vary in a large range, day to day, with meals. So we need something more static, less variable, lesser range, and that value is HbA1c. This is a complex between glucose in the blood and the hemoglobin, and as the glucose level rises, the HbA1c rises. That's a correlation, and that is how it is used as a marker. And we take a cutoff of 6.5%. For all practical purposes, this is what we look in follow-up to look at control of diabetes. Since blood has a life of around 3 months, we do this test every 3 months, and those who have abnormalities of hemoglobin may not be candidates for it, as it is understood. So they may require to rely upon the fasting and PP sugars as an indicator of the extent of control. Same here, 5.7 to 6.4 would be considered pre-diabetic. Now we are majorly going to talk about type 2 diabetes, and that is about insulin resistance and the metabolic issues which ensue because of this. Whereas type 1, which is seen in children, it's an immunological destruction of the pancreas, and from the word go, it is about insulin deficiency. So type 1 is all about treatment with insulin. What happens in this type 2 with time is that they change from this to deficiency. So over time, the pancreas works hard, works more, exhausts, and you find that they also go into insulin deficiency. At this point, type 2 diabetics also require insulin therapy. What are the symptoms? Well, symptoms are very minimal or none. Also because we are checking a lot of blood sugar on more occasions than we ever did. For those who have symptoms, they are of osmotic nature, so you may complain of excessive thirst, hunger, urination, going to urine at night, losing a little bit of weight, feeling dehydrated and fatigued. Or you may have problems due to complications, the damage which diabetes has already done to your body, either because you did not know or because you did not care. When there are no symptoms, why should I be treated to a particular target? What are the concerns? Blood sugar above a certain level in our blood acts as an impurity. You may consider it like that. And the blood circulates to the whole body. So that impure blood damages all the organs in your body. HbA1c is a good way to understand, see how the high sugar complexes to hemoglobin, the level increases as the sugar increases. Similarly, it attaches to all the tissues in the body and causes some or more damage. The most remarkable damage is due to the cardiovascular system, the heart, its blood vessels, and the brain. So you can have a stroke, heart attack, ischemic heart disease, and kidneys. Chronic kidney disease, the leading cause in our country is diabetes. Blindness is another concern. After cataract, it's a leading cause. So eye evaluation is also one part of diabetic management. You have come to know that you have high blood sugar. You have realized that it could be detrimental to me in the long term and I need to control it. What do I need to control? How do I need to control? What are the levels I need to achieve? What are the tools that I have? Is it just about controlled sugar? That's one part of treatment. That is one target that you need to achieve. But you need to look at your entire health. This is one disease where even today in our textbooks, when we talk about treatment, we talk about diet, exercise and drug. And the fourth thing now we talk about more is education. So you see, there is a more holistic approach needed towards management of diabetes. And if you're looking for what you need to achieve, maybe all these, we will talk all of them separately. But the components are exercise, balanced food, controlled blood sugar obviously, normal weight, neither under nor overweight, controlled BP and cholesterol, and here the targets may be more stiff because you have higher cardiovascular risks. So we want to decrease it by cutting down on the other risk factors. Tobacco, nothing to talk about it. Absolutely avoidable. The leading cause of cardiovascular death. The best thing you can do in a diabetic is to cut down or make them quit tobacco, because that is going to have a lot of long-term effect. Alcohol, small amounts, little lesser times, that is the best way. Higher levels are toxic, and what you need is regular evaluation. Not much is needed. If you are controlled, if you know your numbers, if you are able to manage your prescription, understand your drugs, the most important of which is how to dose your insulin and how to check your sugars at home, a lot of job will be done. Maybe the well-controlled ones, 6 months or 1 year. Who knows, you may have an app tomorrow which helps you in managing your diabetes. It is possible. You've got to look at all these parameters. We will discuss them in detail, individually in relevance to diabetes and otherwise as well, so that you can put that all together to achieve better control and to live longer, healthier, with less medical attention.